The first muscle I'm going to macroneedle is the frontalis, which attaches vertically along the forehead, and the needles are placed horizontally against the muscle fiber. The frontalis muscle is responsible for the deep lines in the forehead. I was taught to use 1-inch needles, but these needles are very fine and would bend, so now I use half-inch needles and I just use more of them. The Chinese have been utilizing acupuncture for over 3,000 years to enhance beauty. There is both macro needling involving individual needling, which is what I'm demonstrating now, and micro needling, or stamping, which is puncturing the area with multiple needles at once. In modern times, this is performed with a pulsating machine. The next muscle is the orbicularis oculi. This is a circular muscle around the eye. And as you can see, once again, I'm inserting the needles horizontally. This muscle closes and squints the eye, and when spasmed can cause eye twitching. If you're having an issue with eye twitching, refer to my self-care video that addresses how to self-treat eye strain and eye twitching. And this muscle is responsible for crow's feet. The next muscle is the masseter muscle, which runs perpendicular and is responsible for closing the mouth and chewing. This muscle can be involved with the painful TMJ dysfunction. And acupuncture, along with massage and ultrasound, are several therapies that can relieve this syndrome. As you can see, I'm utilizing 1-inch needles for this muscle since it's a thick, deep muscle. This muscle that I'm inserting the smaller needles in is the plasma. And this muscle expresses tension or stress and causes wrinkles vertically along the neck. This next muscle is the orbicularis oris, and is a circular muscle around the lips and is responsible for puckering the lips. And this causes lines and wrinkles around the mouth. This point that I'm placing the needle into in Chinese medicine is called Li20, and this is a universal point for clearing the lungs. Lung health in Chinese medicine is strongly associated with skin health. I will now continue with the temporal muscle, which fans out on either side of the head and is responsible for closing the jaw and is also involved with the TMJ dysfunction and facial tension. And now I'll continue with the other half of my face. The procerus muscle is between the eyes and is responsible for frown lines. Then finally, I'm completing the acupuncture of the avicularis oris, or the kissing muscle. Does facelift acupuncture really work? Well, I'm 52. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos. To allow me to make more videos for you in the future, please press the subscribe button, press the notification button so you don't miss a video, and press the like button, and be sure to share with your friends and family.